Again, good afternoon, everybody, and welcome to today's Qatar Transportation webcast. It is my pleasure to introduce Dr. Ranjit Godavarthi. Dr. Godavarthi is an assistant professor of transportation at North Dakota State University. He is also an associate research fellow at the Small and Rural Transit Center at North Dakota State University. He works on various transportation engineering research projects in areas such as public transportation, shared use mobility, vehicle automation, transportation safety, pedestrian studies, low volume road safety, roundabout safety studies, and traffic control devices and freight transportation. With that being said, I'm going to hand the presentation over to Ranjit. Ranjit, take it away.
Yeah, thanks, Stephanie, for that introduction. Hello all. I'll be talking today about a recent study that we recently wrapped up, NCHRP 2065, Task 76, Opportunities for State DOTs and others to encourage shared use mobility practices in rural areas. Well, this is our research team. WSP is a prime contractor, and NDSU is a subcontractor, and NDSU took care of a big chunk of research work. And I'm the principal investigator, and Jill Haug from NDSU as well. She is a senior advisor and a director of a small urban rural transit center at UGPTI NDSU. And from WSP team, Sean Liberton is a principal in charge, and Russell Koff is advisor as well as researcher on this effort. Well, before I dive into shared use mobility practices in rural areas, what is shared use mobility practice? Shared use mobility. I'll be using SUM as an acronym in this slide and also in the upcoming slides, so there'll be a lot of repetition. So shared use mobility is simple as transportation service that are shared among users. Well, the list over here shows various kinds of shared use mobility services. They could include public transit, taxis and limousines, ride sourcing, car sharing, bike sharing, ride sharing programs, and also microtransit services, scooter sharing, shuttle services, and neighborhood shuttles. So a broad range of opportunities, options here. Well, smartphone and technological advancements have presented new set of convenient and affordable mobility solutions such as ride sourcing, car sharing, bike sharing, and microtransit services. These are also called as technology-enabled shared use mobility services. And Americans have embraced these new set of convenient and affordable mobility solutions that have transformed the transportation landscape in places both large and small. While shared use mobility practices exist in all size communities, their presence is much prominent in urban communities compared to rural communities. Think about Uber, Lyft, Zipcar, or docked bike share station programs, and they exist in mostly in urban communities. And if you think about their existence in rural communities, they're not very many. So in rural communities, specifically, public transit services are critical for rural residents. Services such as ADA paratransit services, demand response transit services, specialized transit services such as voluntary driver programs, non-emergency medical transportation services, which are also called NEMT services, veterans transportation services, and other human service transportation services are highly relied upon in rural communities. And these conventional services provide lifelines to their users, connecting them to healthcare providers, employment opportunities, education institutions, and social activities. While conventional transit services provide lifelines to their users, emerging shared use mobility services have the potential to fill mobility gaps and provide flexible transportation options. Well, this study investigated various categories of shared use mobility services applicability primarily in rural communities and also in small urban communities when applicable. We have determined potential ways shared use mobility services can supplement and or complement traditional rural transit or transportation services that are already existing. Here, this slide summarizes the shared use mobility practices that we have considered for this research effort. The study investigated various categories of SUM services, such as ride sourcing, which are also called TNCs, such as Uber, Lyft, Phoenix Mobility Rising, or Ruby Ride, etc. Car sharing like Car2Go, Zipcar, Enterprise Car Share, bike sharing, and microtransit services. And the study also focused on mobility as a service framework for applicability in rural setup. Definition that we have used for rural and small urban areas in the study, the research team defines rural communities as those having population of less than 50,000 and small urban communities as those with population of more than 50,000 but less than 200,000. Well, this definition really was established by US Census Bureau and is used by FDA to distinguish between small and large urbanized areas for its formula programs. So we followed a similar definition in our study. Well, this slide over here summarizes the major tasks that are involved in this research effort. We started off with conducting extensive literature review to compile emerging shared use mobility practices and programs primarily from US rural settings and also in small urban settings when applicable. And there are not many shared use mobility practices in rural settings, but there are few shared use mobility implementations that are innovatively implementing their services in rural communities to exclusively meet the needs and challenges of rural communities. Well, we have studied them in detail in our interviews and in-depth case studies. I'll go over them in the upcoming slides. But the next tasks that are involved in the research effort are we reviewed other available shared use mobility toolkits such as shared use mobility toolkit for the cities and any other guidance or planning reports to use the input in our study. We have also coordinated with ongoing research from NCHRP or TCRP, and there's a lot of research going on in the area of TNCs, public-private partnerships, on shared use mobility in general. So we relied upon those research efforts to see what we could use towards our study rather than duplicating the efforts and then implement them in rural context. We have also monitored several FDA MOD sandbox projects, mobility on demand sandbox projects. Out of the 11 MOD sandbox projects, we found 2 of them specifically interesting, which is Vermont Department of Transportation's Open Trip Planner, Agency of Transportation's Open Trip Planner, and also Pinellas Suncoast Transit Authority in Florida. They have partnered with Lyft to provide paratransit kind of services on top of the service providers they already have. I'll go over briefly about the Vermont Open Trip Planner on the next slide. But we also have monitored some of the state DOT's initiatives to support shared use mobility practices in rural areas, such as Michigan Mobility Challenge. And the next task that we have conducted is we have conducted shared use mobility interviews with shared use mobility agency contacts and rural community contacts with regard to initial rural shared use mobility implementations to really learn about opportunities and challenges for various SUM practices in rural communities. And after that, we have conducted 8 in-depth case studies of most relevant rural shared use mobility implementations. We conducted the case studies to learn about planning and implementation aspects of rural SUM implementations. Well, all these above research tasks were ultimately used towards developing 2 final products for our research effort. The first one is Rural Shared Use Mobility Toolkit, and the second one is guidance for state DOTs and other agencies to promote shared use mobility services in rural areas. Just to give a quick overview of what goes into each of these 2 products, the Rural Shared Use Mobility Toolkit can help rural communities become informed about tasks involved for strategically planning and implementing various shared use mobility services. And as for the second output of this study, the guidance document provides detailed guidance on the role of government, rural transit agencies, transportation planning agencies, and or state economic development or small business development agencies. So basically, role of all these mentioned agencies to advance shared use mobility practices in their rural communities. So after the toolkit and guidance documents were prepared, we have convened a rural transit focus group to validate our the rural shared use mobility toolkit that we have prepared. Well, this slide over here shows MOD Sandbox project in Vermont Agency of Transportation. The goal of VTrans Sandbox project is to develop a statewide online trip planner that can generate itineraries for public using fixed and flexible transportation options. If you see here, users could provide origin and destination information for generating travel itineraries in the bottom. Figure here demonstrates the Open Trip Planner, which is called Go Vermont Trip Planner application. With sample origin and destination locations. And the trip planner provides various options for travel using existing transit options, as well as cost of the trip and estimate of the time it is available. And in this trip planner, when a daily ride transit option is included in the trip itinerary, the trip planner provides further details about service availability, the phone number for making a reservation, and minimum advance reservation time needed. Well, we also have Google Trip Planner to perform such kind of an activity, but it is primarily used in urban communities for fixed route services. And providing trip planning for flex route and hail a ride and other non-fixed route services at state level is not available. And this MOD research sandbox research effort deals with filling this gap. And the Open Trip Planner platform has been developed in such a way that it can be adapted, utilized, and scaled elsewhere in US if needed. Well, one of our major research tasks is conducting shared use mobility interviews, and interviews were conducted with shared use mobility providers as well as rural community contacts that are implementing some sort of rural shared use mobility implementations. Interviews were conducted primarily to better understand the applicability of various shared use mobility practices in rural communities by learning from the initial implementations, really, as well as seeking input from successful rural implementations and how they could be applicable to other communities. And interviews were conducted for various shared use mobility categories, like the ones that are listed here, for ride sourcing, car sharing, bike sharing, microtransit, and mobility as service. So for instance, if we take ride sourcing category, we have conducted interviews with ride sourcing providers such as Uber, Lyft, Phoenix Mobility Rising, and Ruby Ride. And as for the implementation of these ride sourcing services, we have conducted interviews with 3 communities. North Mankato in Minnesota, implementing ride sourcing kind of service using Ruby Ride platform, and Missouri Health Tran Partnership using Phoenix Mobility Rising, and Breckenridge, Colorado, I believe, has a Lyft service. Similarly, for car sharing category, we have interviewed car sharing providers Zipcar and GM Maven Car Sharing, and we have also interviewed a couple of communities that have a car sharing, unique kind of car sharing program, Needles, California, and Breckenridge, Colorado. Breckenridge, Colorado has a Zipcar service, but then the service was suspended. So we contacted Breckenridge to make sure what was the challenges or obstacles they have faced for car sharing service in rural communities specifically, so we could potentially see how they could be addressed. Similarly, bike sharing interviews were conducted for bike share systems in Manhattan, Kansas, and Allen County. And we don't have any microtransit implementations in rural areas, but we found a particular microtransit implementation in Arlington, Texas, which is closer to a smaller community. So VIA operates dynamic on-demand ride sharing or microtransit kind of service in multiple urban areas, but also in smaller community of Arlington. So we interviewed that community. As for rural mobility as service framework, we have interviewed 2 communities that were implementing innovative ways to bring in rural mobility as service into their communities. The next research effort that we have conducted is 8 in-depth case studies were conducted to cover rural shared use mobility implementations such as ride sourcing, car sharing, bike sharing, van pooling, and and microtransit services. And I'll go into each of these case studies briefly to provide a quick overview of what scenarios led towards these shared use mobility implementations and what were the impacts of bringing in these shared use mobility services. The first case study that we have conducted is Needle's car share program in rural California. Just to give a brief background about the Needles community, the population of the community is close to 5,000, and a quarter of its population live below the poverty line, and most of them don't have cars. And due to the economic decline, grocery store businesses were closed, and as for Needles residents, most products like fresh produce and groceries, as well as medical facilities and other essential services, are located in two nearby cities, which are Laughlin, Nevada, and Bullhead, Arizona, which are approximately 25 miles from Needles, like the picture shown here of the Google Maps. And providing public transportation services to these nearby cities was especially a challenge for the city because these cities are located in two different states, Nevada and Arizona, and Needles is located in California. Needles has a public transit service called Needles Area Transit, which provides two loop routes and operates a daily ride service, but that is limited to the city limits. Well, analyzing the unique situation in this community, the director of Consolidated Transportation Service Agency for Needles came up with a plan. Consolidated Transportation Service Agency is similar to regional transportation provider in California. So the CSTA director identified an option to provide small, affordable car share program in partnership with Enterprise Car Share to help people transport themselves to nearby cities such as Laughlin, Bullhead, or any other cities to access basic facilities. Well, this small-scale car share program has just two vehicles, a sedan and a minivan. And to convince Enterprise to partner on such a small scale, VVTA, which is Victor Valley Transit Authority, offered a guaranteed monthly minimum payment to cover the car share program costs regardless of the usage. Well, this subsidy from VVTA allowed for car share program users to pay just $5 per hour, like the picture shown here towards the left corner, which includes both insurance and fuel. And there is no need for membership cost or sign-up fee. Both of them are waived to make it affordable option for rural residents. And as of August 2017, the program had 50 members, and minivan was a popular car among the two. Most of the times, residents in this community split expenses to share the minivan and to go to a particular location and then split the expenses. And this successful small-scale rural car share program has gained national attention, and the revenue generated from the program has paid off most of the costs associated with running it. So this is one of a successful car share model for rural communities. The next case study is Green Right Rose electric vehicle ride sourcing program, and this is in rural community of Huron, California. And Huron is a rural community in Central California, and it has predominantly Latino population of over 7,000. And it is one of the California's poorest communities, and quarter of its residents don't own a car. And Huron community already have an indigenous Uber kind of service or indigenous ride sourcing service, and it is called Ride-A-Rose, where retired farmers provide rides to local residents. The maximum distance for the service was to Fresno, California, like the Google Maps shown here, a nearby city that is located 1 hour away. And Ride-A-Rose use their personal vehicles to provide rides and rides to access facilities such as hospitals, government agencies, and other critical services. And most of these services are located in Fresno, California. And Ride-A-Rose generally charged the riders for gas and lunch expenses. And those expenses are still considered very expensive for already poor residents of Huron. Well, to strengthen the Ride-A-Rose service, the mayor of Huron secured a grant funding from California Public Utilities Commission to form Green Ride-A-Rose program. Well, this funding was provided to Latino Environmental Advancement and Policy, which is also called LEAP Institute. to develop Green Right Roads program. And this non-profit Green Right Roads rural ride sourcing service was launched in 2018, and the program has 2 electric vehicles and 4 veteran retired farmers serving as volunteer drivers to provide affordable transportation to underserved individuals. Trip costs for the Green Right Roads program are supposed to be more affordable compared to previous informal Right Roads program, and the program is intended to increase public health, education, and economic empowerment for rural families. And this is an example of right sourcing implementation using vehicles and volunteer drivers in a rural community. And going into the next case study, we have investigated Michigan Mobility Challenge grant to improve demand response and healthcare transportation services in rural counties. Well, Bosch and Split, company Bosch acquired Split, so I'll be referring to as Bosch/Split. But Bosch has acquired a grant of $990,000 from the $8 million Michigan Mobility Challenge grant program. And the grant funding will improve paratransit and healthcare transportation services in 3 rural Michigan counties, namely Grand Traverse County, Benzie County, and Allegan County, that were highlighted here on the right lower corner. And Split will use the funding to integrate the Split Rides platform with software already that is being used by rural transit agencies to reduce cancellations and no-shows with improved alerts and reminders, develop a mobile app for users to secure rides, and coordinate with the volunteer driver pools with enhanced web portal. So if you look at the lower left corner of the Split architecture here, riders could use mobile phones to book a trip or to manage a trip, or they could use web portal instead of mobile phones. And ride coordination is provided for trip reservations on, say, paratransit trips. Triple confirmation is provided to the rider and to the healthcare provider and maybe to the caretaker. And reminders are also provided the day before the trip to the rider and the morning of the trip, and while the ride is on the way. So three reminders, so no shows would be reduced. And Split Ride platforms is also integrated with the transit agency software. So this essentially demonstrates a mobility as a service framework in rural communities. The fourth case study is again rural mobility as a service in Winnebago County, Wisconsin, and the program is called Winnebago Catch a Ride W-Car program. And for this program, Winnebago County received a grant of $100,000 from Easter Seals Project Action Consulting to fill its rural mobility gaps. And as a result, a rural mobility as a service was created, and this service was called W-Car program, and it was created to integrate all available transportation services on one single platform, as well as add a ride sourcing program with volunteer drivers on the Phoenix Mobility Riding platform. I will talk a little bit about volunteer driver ride sourcing platform for today in my presentation for this case study. And the W-Car was developed in October 2018 and for 1 year pilot lasting until September 2018. And W-Car program uses Phoenix Mobility Rising platform and volunteer drivers to fill mobility gaps that were not served before. There are already transit services that are available in the Winnebago County, and to fill the mobility gaps that were already existing, that is where W-Car will pitch in to meet those gaps. And for the W-Car program, volunteer drivers will use their personal vehicles to provide ride sourcing like trips on Phoenix Mobility Rising platforms. And riders will be charged a $2 booking fee and a federal mileage reimbursement rate of 58 cents per mile. And payment from the riders will go directly to the drivers. And when the case study was conducted, riders need to use a call-in number to request rides, but soon a smartphone application was supposed to be developed for riders to request and pay for the rides. And the goal of the W-Car program is to hire 20 voluntary drivers in the rural community to meet the unmet transportation needs. And the screening process for adding voluntary drivers includes conducting interviews, background checks, and vehicle inspections. Diving to the next case study, which is Via Microtransit service in the city of Arlington. Well, like I mentioned before, there were no rural microtransit implementations in US when case studies were conducted early this year. Most urban microtransit providers such as Bridge and Chariot ended or faced problems with their US operations. However, Via service provider operates dynamic on-demand style of trips and were successful in large communities. And they also have a microtransit in Arlington, Texas, a fairly small community with population under 400,000. And this community was included as a case study to understand its operations and potential to fill mobility gaps in small communities with microtransit services. As for Arlington, Texas, in 2017, City of Arlington partnered with Via Transportation to provide a microtransit service trips to its central business district. And Via Microtransit service entirely replaced a previous fixed route bus line in Arlington, Texas, to provide just on-demand trips in premium vans, which are Mercedes Metris vans that are shown in the slide here towards the left. Budget for the first year operations in Arlington was funded by the city as well as FTA. And the microtransit service has proven very successful, and city has expanded the service several times and added more vehicles to meet the demand from the community. With this system, customers can book a ride in one of their vans using via smartphone application, and their sophisticated technology will match the customers with other riders going their way. The figure on the right corner here illustrates steps involved in booking a ride using the Via mobile application. And for users who do not have a smartphone, rides can be requested by calling a live support phone line. So there is an option apart from using a smartphone. So if you look at the picture on the right here, it's like any other TNC application. You select the pickup and select drop off and confirm the order, and once you have a ride, you wait at the pickup location that is mentioned in the smartphone application. And as for the availability, the Via service is available between 6 a.m. and 9 p.m. Monday through Friday, and between 9 a.m. and 9 p.m. on Saturdays. And rides are charged a flat rate of $3 per trip. One of the frequent complaints with microtransit services is that they are expensive when compared to public transit fares. Well, subsidizing microtransit fares can be attractive to rural and small urban community residents. The Via fare is subsidized to make in Arlington to make on-demand microtransit trips affordable. Without subsidies, the trip would have costed approximately $9. Via also has an option to purchase a weekly pass of $15, which allows them to take up to 4 rides each day. And in Arlington, it also has a wheelchair accessible service called HandyTran. And HandyTran is an already existing door-to-door transportation service for elders and persons with disabilities, and it is still available to users along with Via operations. Well, in addition, Via also operates 2 HandyTran paratransit vehicles, paratransit wheelchair accessible vehicles on its platform in Arlington to provide on-demand microtransit vehicle wheelchair ride sourcing trips. It is important to provide comparable trips, comparable on-demand trips for wheelchair passengers as well, when there are more options available for general public. Via has seen a 100% increase in public transit ridership when compared to its previous fixed route service, and have achieved a good customer satisfaction rate. The next case study we have connected is non-emergency medical transportation and its partnerships with the Lyft provider. And For vulnerable populations such as elderly and disabled, finding reliable and affordable transportation to medical appointments can often be critical impediment to accessing the care that they need. And in response to these issues, NEMT agencies and medical service providers have developed partnerships with ride-sourcing companies to offer more affordable and convenient transportation options to patients. In 2017, Lyft partnered with American Medical Response, AMR, the largest provider of medical transportation in the United States, to allow patients to use Lyft platform to schedule rides and to their medical appointments. Since then, Lyft has formed partnerships with multiple health insurers such as Blue Cross Blue Shield and Humana, as well as NEMT providers including logistic care and circulation. And impacts of Lyft NEMT partnerships includes reduced wait time for riders, increased on-time performance, and cost efficiencies for patients across the United States in general. The case study that we have conducted on bike sharing is Allen County Bike Share, where we specifically studied a library model of bike sharing. And talking about bike sharing, they have gained much popularity in the latest decade in US. While dock bike sharing systems have been sustained for many years in large cities, their cost is likely out of reach for rural communities. Costs associated with bike sharing include station costs, support staff, and such. And if you look at just the cost of a bike in a bike share system, it is anywhere between $3,000 to $5,000. And therefore, many rural communities have been experimenting with low-cost bike sharing models, and we conducted a case study of one of such low-cost bike sharing model here, which is a library model, which is an innovative rural bike sharing model that gained national attention, called library model, and it is developed by Allen County, Kansas. And this program allows the public to check out bicycles for free for different periods of time ranging from minutes to months. While Allen County already had the built environment to facilitate bicycling in their community, a barrier to bicycling identified by community members was a lack of bicycles themselves. So a library bike share model was set up with 20 bicycles distributed among 4 different locations. And with free rental, the program is aimed to meet the needs of residents as well as low-income population who may or may not have access to smartphones or credit cards. Checking out a bike is simple. A patron must simply provide a picture ID and sign a waiver form. And the program has seen with very minimum publicity has increased its ridership to 100 checkouts in the first 3 months. The last case study that we have conducted in our research effort is Pennsylvania Van Pole Incentive Program, PVIP. To cover statewide shared use mobility initiatives for a case study, we have profiled a PVIP program in our case studies, and this case study looks at Pennsylvania Van Pole Incentive Program. The PennDOT launched this PVIP in 2018 to provide an economic incentive to create new van pools and ultimately an affordable commuting option for workers across the state. Well, a PVIP was launched with an initial allocation of $1 million from PennDOT and has created several partnerships with private companies and transit agencies to operate the van pools in its state. And the program has expanded the availability of van pool options and reduced the cost for van pool commuters as well. And PVIP has so far supported creation of approximately 75 van pools in the state, with potential to create even more in the years ahead. Well, with all those interviews and case studies, like mentioned before, output from all the initial tasks were ultimately used to develop 2 final products for this research, which is Rural Shared Use Mobility Toolkit and guidance for state DOTs and other agencies to promote shared use mobility services in rural areas. So I'll go over the 2 outputs for the research from the research in the next coming slides. This slide provides a quick overview of to describe each of these outputs. So if we look at a quick overview of Rural Shared Use Mobility Toolkit, it is a 5-task process. So if a rural community wanted to implement some sort of a shared use mobility service in their community, they could follow this 5-task process, starting from planning and identifying mobility needs till implementing and gathering funding for their shared use mobility implementations. So task 1 is basically identifying mobility gaps in the community and determine the service needs. And from the identified mobility gaps in task 2, shared use mobility categories that best suits rural community needs can be identified. It could be either ride sourcing or a microtransit or bike sharing, pretty much anything based on the community needs. Task 3 is based on the identified shared use mobility category. We identify private partners who are shared use mobility providers that could provide intended transportation options in the rural community. Task 4 will look at challenges, accessibility, and impacts. And task 5 is, which is also important, is funding and implementation for any of these implementations that are identified. Let's look at each of these tasks quickly. Task 1 is basically identifying mobility gaps and determine service needs. So input could be identified from citizens and as well as community representatives. So the current transit or transportation riders could provide input on mobility gaps, transportation barriers, or efficiency of the current system that they are using. And input could also be gathered from transportation stakeholders about unique transportation, rural community issues, or mobility challenges. So the input gathered could be helpful towards discussing better strategies to meet these mobility needs. And for this, leadership from community partners is needed. And community partners could form groups such as planning committee or advisory group and follow strategic planning process to come up with an idea or better strategy to meet the mobility needs through technology-enabled shared use mobility practices. So for this strategic planning process, rural communities can engage multiple entities ranging from state DOTs, rural transit agencies, human service agencies, and such. And while a strategic planning process is followed, it is important to have a community champion to lead the effort from the planning stage till the implementation stage. So any of the any of the participant in these agencies could serve as a community champion to take motivation towards bringing in a shared use mobility practice to the community. And at this stage, while many agencies are working, these agencies could potentially become public partners to essentially assist in the planning process. The second task in the Rural Shared Use Mobility Toolkit is basically determining a shared use mobility category that best suits rural community needs. And some rural communities already have public transit services, and these services provide lifelines to transportation disadvantaged population. And rural communities with inadequate or non-existent transit services maybe could think about assume strategies that have the potential to better address rural transportation challenges or mobility gaps in a cost-effective way. And based on the needs that were identified in task 2, a use case could be identified for a shared use mobility service, and a specific shared use mobility strategy can be related to the use case that is identified. So some of the strategies that we have been discussing so far are ride sourcing, car sharing, and bike sharing, microtransit, and mobility as service platform. So any of these strategies, one of these strategies could meet the use case that is identified by the community, one or more. So I'll discuss briefly about each of these strategies and opportunities for them in rural communities. If you look at ride sourcing services, Ride sourcing services, if you look at in urban setup, they could operate by themselves and could gain profit. But in rural communities, there is not much demand for ride sourcing services. It is very important for ride sourcing services to partner with public agencies and work with while working on some grant funding. And also, most of the ride sourcing providers, they are not available about the unique rural transportation challenges. So public-private partnerships and working together is a key for potential ride sourcing service implementations in rural areas. And as for the challenges with the rural communities, some of the opportunities for implementing these services are ride sourcing services with voluntary drivers. A lot of rural communities already have voluntary driver programs, so the program could be tweaked if needed to make it a ride sourcing service, and contracting drivers through interviews, background checks, and that are essential as part of FTA funding if FTA funds are used or if some other funds are used, and making sure that ride sourcing service is available and in definitely hours of operation. So if a person want to take a ride sourcing trip, say at the off-peak time, getting a trip on a regular ride sourcing platform could be impossible, but it is important for the service to be available throughout the day. So a rider could get a trip within the defined time frame. And ride sourcing services could use the existing fleet, such as accessible vehicles for providing on-demand trips, and it is important to subsidize the rides for ride sourcing trips, so it could be affordable option for rural communities, and essentially integrating these trips to the rural transportation network could be helpful towards meeting the mobility gaps instead of duplicating them. As for car sharing services, if there is a unique need identified for providing access to a vehicle, short-term access to a vehicle for residents who have a license, driver's license, a car sharing service could be a potential opportunity. And most of the car sharing services are existent in urban communities and not many in rural communities, except for few university towns and tourist communities. And if a car sharing service has a strong use case in rural community, it could be implemented on a small scale. And if it is implemented, it is important and useful if this service could be subsidized, so it could be an affordable option for rural residents. And as of now, car sharing providers do not have proper business models for their applicability in rural communities. So developing car sharing business models tailored for rural communities could also help in multiple deployments. Similarly, in microtransit services, there were no implementation of microtransit services in rural areas, but based on our interviews and based on our case study findings, there are providers who are interested to provide microtransit services in rural communities, and if they had to be provided, subsidizing the fares could be a key to success to make it more affordable and attractive option. Bike sharing services, there are regular bike sharing services, but they could be expensive for rural communities. So low-cost bike sharing service options are also available based on the funding availability for rural communities. And if there is very less funding, there is also a library model where the community could use bikes that are already existing in the community to put in the system and rent it out for free. So again, one other option is mobility as service, and the mobility as service framework can essentially integrate all public transportation services, voluntary driver programs, and other transportation services on one platform, and it could provide one-stop information for all services, add additional shared mobility services, set up alerts, and manage voluntary driver programs and interoperability, and pretty much wide range of opportunities here if rural communities can integrate all of their services and assets on one platform to better manage and operate. The task 3 is public-private partnerships, which is very important because once a rural community identifies use case and a kind of assumed strategy that they wanted to follow. They should identify a private operator who could operate and meet the needs of the rural community. So this is considered a critical step, and while looking for the shared use mobility providers, community could start to look for providers that have operated previously in rural communities. So these providers could have more knowledge about unique rural challenges and mobility needs, and they could cater to the needs of other rural communities as well. But rural communities could also attract shared use mobility providers by RFPs or grant processes. So there is one research study which looks exclusively at transit agency and partnerships with TNC. So this study could be of merit for rural agencies as well while they are getting into public-private partnerships. So once the shared use mobility strategy and shared use mobility provider is identified, it's important to look at some of these things such as challenges, accessibility, and benchmarks. And and while the system is set up, public and private partners can start planning for the operations, such as characteristics of operations and how do they plan to tackle the obstacles, challenges. And some of the challenges is limited in rural communities is limited funding availability and low demand, and gaining trust is very important in rural communities. And having broadband coverage is also non-existent for most communities, and these shared use mobility services need to have strong broadband coverage for their operation to be flourished. Accessibility, it is important to have accessible services while planning for, say, ride sourcing or ride splitting or microtransit kind of services. It is important to have compatible services also for wheelchair riders as well as general public. And some residents might not have access to smartphones and bank accounts, so strategies should be developed to take care and provide access to them as well. And during the planning process, benchmarks could be developed by public and private partners to see how the system performs, such as how many users do they plan would be good for enrolled, and trips provided, and cost per trip, customer satisfaction, metrics like that. So the last task and very important task for shared use mobility toolkit for rural communities is funding and implementation. And availability of the funds is essential for piloting any kind of shared use mobility service, and funding needs vary by shared use mobility service category. So if you want to bring in a ride sourcing trip, it could be expensive, but if you want to bring in like a low cost bike sharing, it could be not so expensive, and maybe there are some local funding providers that could cover that cost. So they're pretty much broadly varied. And it is important to identify that shared use mobility practices are capital-light business models and benefit more from operational expenses. And most of the funding sources, federal and state funding sources, have a big chunk of money for capital costs. So as for shared use mobility services, they would benefit more from operational costs. And some of the opportunities are FTA formula funds and MOD grants. And as for FTA requirements, some services may be eligible for FTA formula grants, which meet the definition of federal public transportation. And for such services, rural agencies or transit agencies could be recipients, and they could contract it out to shared use mobility providers as subcontractors. Shared use mobility providers themselves are not eligible to be recipients or sub-recipients of FTA awards. Similarly, more funding options are state DOTs and other national, state, and local agencies, and also from some community initiatives. So those are some of the tasks in the task 5, and some implementation. The contract setup process could take anywhere from 6 to 12 months, and it is advisable to start a pilot phase in the first 6 to 12 months and then test it out, and then continue with modifications that were from lessons learned from the 6 to 12 month pilot phase. Marketing and outreach is also very important. It's important to educate people about the new and effective transportation option available for them, so it could be used effectively. The next item, which is output from our research effort, is guidance for state DOTs and others to promote shared use mobility services in rural areas. Like we mentioned, adequate funding in rural areas is always a challenge, and traditional transit or transportation services are very expensive, but they provide very critical services to rural communities. And even with the right amount of traditional services, they may not still not be flexible enough for the riders. Still needs advanced planning and may not be available for everyone. So to fill this gap, shared use mobility services have a potential opportunity. And some of the opportunities all these agencies could provide to promote rural SUMs are diversifying state funding between traditional and SUM services. So if it could allocate some funding for rural agencies to contract some SUM providers, that would be helpful to bringing them in. Also, FTA funds are very important, like we discussed before, and some of these funds are available are eligible to be uh, to contract out shared use mobility providers. And a one-stop information could be very helpful. It has been observed from our research that not a lot of shared use mobility providers are not knowledgeable about the unique challenges in rural communities. And similarly, rural community stakeholders are not available about all the shared use mobility options. So it's nice to have one-stop information to educate both the entities. And broadband services are very important. So ensuring that the broadband coverage is increased in rural areas could help flourish these services. And it is important to advocate that transportation is important for healthcare and employment in rural communities. And regional transportation agencies also have a big role to play if they wanted to test out innovative transportation services in one of their rural community in their jurisdiction, and see how it performs, and maybe use the model in other communities as rural communities in their jurisdiction. So they could also have a big role to play to promote rural SUMs. Well, with that, I would like to take a chance to acknowledge the panel for the study, the project panel that have directed the research effort, NCHRP 2065, which is focused on research for ASTO Standing Committee on Public Transportation. And I would also like to thank the rural community contacts, shared use mobility providers, FDA, and also focus group participants who provided valuable input that went into various of our research efforts. With that, I'll be available to take some questions. We recently wrapped up this study, and we should have a full report available sometime soon. I could send you a report in case you're interested, link to the report. But I'll be happy to take some questions if you have at this time.
Okay. Thank you so much, Ranjit, for the informative presentation about your recent study. And yet the first question that somebody came in and said that it looks like the NCHRP listing shows the task as completed in April of this year, and I had assumed the report was already available. Do you know when the expected release date is for that report formally?
When the project was initially given to us, the initial date was April, but then we ran into a delay setting up subcontract agreement, and then the new deadline for the project is I believe November ending with an extension. So I'm guessing early next year would be a time where we could have the report online and available to distribute.
So it looks like Velvet from TRB is on the webinar, and she said that the report is anticipated for release in November or December. So
yep.
What we will do is Ranjit has requested that we not provide a copy of his slides until the report is released. So as soon as we get notification that the report is released, we will make the slides available for download with the recording. So we will also provide a link to the report as soon as it is released. So thank you for the questions about the PowerPoint slides and the report. There was another question that kind of came in that talked about wanted to know how much was the subsidy, and I believe that question was related to the bike sharing.
Yes. I, I I think the subsidy is not I mean, under $50,000, but the system that was used is Allen County used affordable bikes instead of expensive bikes that are used in bike share systems. So
Okay.
the system as a whole didn't cost so much, but I don't have the numbers with me.
Okay. That's great. Okay, so it does look like we are running out of time. We've got about a minute left, so what I'm going to do is open up the evaluation on your end. If it, for whatever reason, the evaluation does not open up on your screen, a click in the link section at the top of your screen, you will see evaluation 9.26.19, and click Browse to on that, and that will open up the evaluation. The feedback provided is very important to Ranjit today, as well as the entire Cutter Transportation webcast series. It will just take you a couple minutes to complete that survey. We do have our next Cutter Transportation webcast scheduled for a Tuesday, October 15th, on the overview of Florida's draft beneficiary mitigation plan to reduce diesel emissions, presented by uh, some researchers here at Cutter and a couple other presenters. So again, thank you so much for joining us today, and thank you, Ranjit, for the very informative presentation, and we will see you in October. Thank you.